Okay, so this lecture is going to focus on type 2 diabetes, and we're going to look at some of the non-insulin treatment options. So these are oral medications, pill, tablet form, that are used predominantly in the management of patients with type 2 diabetes. And of course, special thanks to Dr. Lalita Prasad Reddy, a friend and colleague, who's really a diabetic specialist, both in terms of management, but also in terms of patient education. And so I think if you guys do rotations in various internal medicine departments, you'll probably work with her at some point. So what we're going to be focusing on is really the classic kind of type 2 diabetes, which is really about 2/3 of the patients that are out there on average, and of course all these other different pieces of the pie are different types of diabetic patients, some type 1, and various subsets. And so, but for today we're really going to focus on type 2. Of course, diabetes is expected to jump by 50-something% by 2035. This is data from 2013 showing in China there's almost 100 million people with diabetes. In India there's 65 million people. We're not too far behind. We've got almost 25 million people with diabetes, and so it's definitely a prevalent disease and one that you will definitely need to manage adequately. Let me get this thing out. There we go. And so, of course, at this point, you guys understand the difference between type 1 and type 2. The previous case focused primarily on type 1, and basically these patients have a decreased insulin coming out, and basically are resistant to alterations in blood sugar. The type 2 diabetic, we're looking at really the muscles unable to use glucose effectively because of this persistent kind of insulin resistance. And so other factors play into role in terms of how these patients are managed, and we'll go through some of those differences throughout this lecture. All right. So here's the pharmacological treatment. These are the non-insulin based medications for diabetes, and there's really 7 major drug classes. There's a few more that don't really kind of fit into a category, but these are the 7, and these are based on the chemical structure. So in some cases there's 3 or 4 or 5 drugs per category. In some cases there's just one. So the biguanides, a good example would be the biguanides. There's really only one biguanide that's commercially available, and that is metformin. So this list is not terribly long. Okay, so let's go into the first class of drugs, the sulfonylureas. Okay. Oh, but before, I just want to quickly summarize. These are the major actions of the medications, and so you can kind of further subdivide these different drug classes into maybe 3 different major sites of activity. And so both the sulfonylureas and the I can never say this one, meglitidines, are basically drugs that will stimulate the pancreas to make more insulin. Sometimes they're deemed secretagogues. There are drugs such as the biguanides and the thiazolidiones, which sensitize the body to insulin and or either control the hepatic production. Sometimes we call these insulin sensitizers. And then the third rough group of drugs are the drugs that alter glucose absorption and postprandial or post-meal insulin release. And those include basically all the other drugs, the alpha-glucosidase inhibitors, the DPP-4 and the GLP-1 drugs, which are kind of closely related in terms of their mechanism, as well as the amylins. So those are the major sites of drugs, and so let's go into the first category here. And so this is looking at the major adverse effects. Really, in terms of all of these anti-diabetic medications, the major adverse effects are really just hypoglycemia and weight gain. And then some of these other drugs have some unique side effects or toxicities and so forth. But of course, with hypoglycemia, that's an acute event, and it can be fatal if left untreated. And so a lot of times these diabetic patients will keep like some orange juice or apple juice or a candy bar in their car or in their desk. And if they do have a hypoglycemic crisis, they can easily have some sugar and kind of come out from that. Because of course, if your hypoglycemia goes too low and is left unchecked, changes in pH, and then of course coma can ensue. The other side effect to almost all of these drugs is weight gain. And that really kind of corresponds to an improvement in the glycemic index, and it basically is telling you that the drug is working. And so in order for these drugs to kind of be to offer the most therapeutic benefit, you're going to have to counsel the patients to reduce their caloric intake and or increase their exercise to kind of alleviate some of these weight gains that are pretty common for most of these drugs. Okay, so we'll call this the introduction lecture, and then our next one will be our first group of drugs will be the sulfonylureas.